Good morning. We don't quite have a quorum, but we're not voting today, so I think we can go ahead and get started. Because we actually have 4 pretty meaty topics today to go through with a pretty number of items. I appreciate the material that we received in advance. That was very, very helpful. In fact, the 4 topics in order. We are going to hear a presentation from Dr. Lewis Finney on Smart Start and our ARPA project update. You all recall that was one of our largest ARPA grants of a little over about $3.5 million. And we're going to hear an update, a fire study update, which is going to be a year-long project, and Damon Sanders Pratt will review that. We're going to hear a PAYGO discussion. These were raised during the recent budget cycle a month ago, and Kim Bussey is going to do that. And we're going to have a community grants discussion with Aisha Carter at the end, which was also, in fact, all 3 of those last items were discussed in the budget cycle. So I'm pleased to turn the meeting over to our new county manager. We call him new anymore, but Chantel Robinson.
Thank you, Mr. Chairman, and good morning, everyone. So our first update, if Dr. Lewis Finney would like to come up and provide an update on Smart Start.
All right. Good afternoon, commissioners. Good afternoon, audience. Dr. Lewis A. Finney, Jr., President and CEO of Smart Start of Forsyth County. I actually have 2 people with me as well, if you can introduce yourselves.
Good morning. I'm Dr. Tasha Prieto with Prismatic Services. I'm the evaluator on the project.
Good morning, Glenise Highsmith with Smart Start Forsyth County.
Okay. Good morning. As our presentation is up, I'll begin, and then we'll have our evaluator also come in with some more specific details. Again, I want to also begin by thanking you again, because as you all know, this was something that was really needed in our community, and really glad that we shared this potential partnership. So we're actually glad to share this information with you. Go to the next slide. Okay, there it is. As you all are aware, we pretty much contributed about $3.7 million, and this was a partnership that was also done with the city. And also, it's really spearheaded by Pre-K Priority. And some of you are familiar with Pre-K Priority. It's something that started about 10 years ago. That's really spearheaded with the county, the city, the public schools, but also several nonprofits at the same time. And these are some of our key partners. We went through this particular process with the county, really felt that it was important to do a collaborative approach. As an organization with Smart Start, we understand even though we are the conveners for early care and education, we cannot do this job by ourselves. So what we did was sought out some very key partners, one with the public schools, which is the key partner, Prismatic, CCRC, Foresight Futures, who does our data management, the Hispanic League, who's doing a great job with some of our translation, and then Family Services, who provides the Head Start program. I just want to give you just some details as far as the classrooms that were served. We went through this process. It was something that we actually had to go through the private child care providers to get people to really participate in this. Many were apprehensive, but this is the first time that we were actually looking at all classrooms, not just private, public schools, but also the Head Start programs as well, to really make sure that there was some equitable distribution of services, but also to make sure that all children in our county received some high-quality services. And this is to give you some example of some of the slots that were funded and how many we actually serve. And those who are familiar with Family Services, they serve pretty much the most at-risk children, but also some children with disabilities as well. And you see as well, there's also a focus on teachers and teacher assistants. Because we went through this endeavor, we had 2 major components of this. One was around the workforce, because we found the workforce was hitting us twofold. One, we did not have a lot of people who could not go to work because of lack of childcare, but also extremely difficult in our particular community to hire teachers. Right now, on average, we're still about 25% understaffed, and most of our centers are actually closed because we don't have teachers, not because we do not have children. Okay, trying to use this. Okay, thank you. And we also wanted to look at specific geographics and locations to make sure that we're covering the county and the city. So this will give you kind of idea, because one of our focuses as well was to look at childcare deserts. And what a childcare desert is that's when you have a specific community that lacks specific childcare. In Forsyth County, we're about 38% of our county has a childcare desert, where a person does not have a place to go. So what they will in turn do is have to bus their child somewhere else, or they'll in turn go to Greensboro or another community because there's a lack of childcare in our particular community. So we want to make sure that we're targeting those areas to improve some of the education as well. We also found through this process that we have a lot of languages that are spoken. And one advantage we had with using the Hispanic League is that they actually were able to translate multiple languages. So it wasn't just something specifically focused on Spanish in the translation, but also multiple languages. But the other thing the Hispanic League did as well is focus on some cultural competency as well in helping some of the families and some of the schools that have primarily Spanish people as well.
Dr. Finney,
Yes, ma'am.
if you give me a moment, if staff could get this icon removed so that I know that we have the pamphlets, but we
That's a
can
good
see it on
point.
here as well. Thank you.
That bi-monthly discussion.
And it keeps coming back up.
Thank you for that suggestion. And this is just to give you an idea of even the rates in the breakdown and the median income. And this is our educator race and demographics. Contrary to popular opinion, people assume that the private childcare industry are people who have high school diplomas and GEDs, but actually that's far from the truth. Most of our people that are in the private industry actually have a degree or a certification. In order to work in a classroom, you actually have to have at least a CDA or even a degree or a BK license. The unfortunate reality is that those who are having that degree have a very low salary, and their salary rates can be anywhere from about $11 to $16 an hour to take care of our children. And this is pretty much the educator demographic race. And primarily with our educators, about 99% are actually women. I think we got maybe one male in our entire county. I'm not sure who this guy is, but we do have one. But it's likely a relative, but primarily it's a female, minority, women-owned business in this particular business in childcare. And this gets to the educators level. And these are all the teachers that we work with. We have some with master's degrees. Only 7% have a high school diploma. And of that 7%, they all have multiple certifications, whether it be a child development associate, certified to work in a classroom, some health and safety certifications. And we have a percentage that have master's degrees. But even with our assistant teachers, who make anywhere from about $8 to $11, we have 3% have a master's degrees. So we find from this population is that, as you see, they're not only making a little bit of money, but they actually love their job, and they're quite educated too. This will give you one of our biggest challenges were the salary statistics. And this is an average of some of our private, our Head Start, and our public schools, because what we wanted to do is do a pay parity study, but also ensure that those private child care providers that we're working with, but also the providers that are with family services as well, have a salary that is equitable to the public schools. And even as some of you all may know, even the public school salary teachers are not, in my opinion, where they should be. But we still try to at least get these private providers to where the teachers are. And what we're really proud about is overall, we're looking at 85% compared to 63% related to retention rate. So we're really proud that our project really helped for that first year, the retention rate, because that was normally quite high.
Can I stop you right there?
Yes.
Dr. Finney. On you give the as compared to 63 to 84% nationally. I'm kind of curious because the retention was one of the big issues here with salary parity and salary equity. And I'm kind of curious I'd really be interested in how they compare to, for example, for the Winston Forsyth County schools, it should be the same because there was really they're the base and it's not an issue. But for the other three, Head Start, NC Pre-K, and particularly the private providers, it would be interesting to see what their retention rates have been before this year.
Okay.
I mean, because I don't know whether that's good or not. I mean, for all I know, private providers, people are happy, and they just keep, they were 85 already, and that this salary stuff just made them happier, and that it really didn't contribute to their, their retention. And I think a better, comparison to a range of 20% nationally doesn't tell us whether this is working or not.
Yeah, that's a very good perspective, because actually what you have before you is not the full evaluation. What you have is a summary. Your full evaluation will actually come in September. Well, I'm gonna have my consultant, can you answer that question?
Yeah.
Yes.
So you're exactly right. We're looking to see whether or not this, the global idea, better teachers, better classrooms, better outcomes for students, and retention is one of those key factors for teachers, because this grant is pouring resources into the current group of teachers, so we hope that they stay. We are looking at a comparison to control classrooms, as well as some historical data for the teacher in the various environments compared to the outcomes for this group of teachers.
It's good. So the answer to the question is it better or worse?
Don't know yet. We won't know until the report is finalized in September.
Okay.
Well, thank you for that question. And this is just an example of our tuition and credentialing assistance. 11 participate in our QRS 5-star system. And the way that what the QRS is every state, actually most states, have what's called a quality rating system. We're one of those states who does have one. In Forsyth County, Smart Start is responsible for managing that quality rating system to identify to the community what's actual quality. And once you get to a rating of 3, 4, and 5, as a Smart Start agency, we're able to give you additional funds for success. But also as a parent, if you want to look for a facility, you want to look for a 3, 4, and 5. One thing we added really was a major emphasis on data in this particular project. And part of our data management was managed two ways. One was for families. We use a program called Child Plus, which is an evidence-based program that can look at different indicators in health, family services, mental health, and dental as it relates to children and parents. And we also use an assessment tool called Teaching Strategies Goal Assessment that's also research-based, but also approved by the state. And you'll see some of that data as well. Something we added as well throughout this process was healthcare, because when we first initially did this, one thing that was missing was really the importance of health. And what we found through this project, particularly the first month and started, and most of you all may know that if a child is not healthy, doesn't have good dental and health, they're not going to do well in education either. So we added a health component and have a child care health consultant that Smart Start has that actually looks into the centers to check on health, but also work with the staff so they can look at different indicators. But we also added this in some of our data management as well. And in most of these cases, these children have never had this type of experience as it related to dental and vision. So part of what we did to complement that is we have a health fair ourselves that we do this year that we're doing free to the public to try to address some of these gaps when it relates to missing dental, vision, and hearing screenings. Something that's new to the private industry that we're adding, again, is the vision and hearing, which is something that the Head Start program gets, but the private child care doesn't get. And I don't believe the public school gets all of these type of services. So this is something that's a little bit different that we found in this project was adding the health piece. Now I'll introduce Prismatic, who's going to give you some further details unless there's any questions that you all have of me. Okay, thank you.
Good morning. Prismatic Services was the firm selected via competitive bid to provide the evaluation component to this work. Prismatic's been in business since 2007. We're headquartered in Charlotte. I've been doing evaluation work since before then. Next year will be year 30 for me. So in terms of where we are with the evaluation, this work was intentionally designed to be mixed methods in nature, and a lot of our focus for a year one grant is implementation fidelity. And so most of our efforts went into helping grant staff develop the systems and processes and analytical mindset for how to collect good data, how to store the data, how to make sure we've got all the data that we need to be able to say things at the end of the work, yes, we've proven that this intervention works. And so that's where our work has been. Data collection and update analysis, we've collected data on 4 different valid and reliable measures. That includes the TS goal, the Brigance, the ECHRS, and the class. Collectively, they cover things such as the classroom teaching environment, teacher-student interactions. The Brigance is a child developmental screener, and TS Gold is a child assessment, and they're all appropriate for the age ranges that we're looking at. We also collected survey data from parents of students in the program, teachers, directors in the program, and partners in the program. We conducted focus groups with parents, teachers, and directors, as well as some one-on-one interviews. In the no-cost extension period going into next year, we'll be doing more of the same. Some initial early results from the ECHRS, which is the Early Childhood Environmental Rating Scale. This is graded on a scale from 1 to 7. 5 is good. 6 and 7 are a little better, but 5 is where you want to be at least. And in terms of all of the classrooms within this grant, they were all at the type level, had an overall average of 5 or better. One of the things that was conducted as part of fidelity of implementation with this is Rand made sure that where classrooms had shortcomings in individual measures within the ECHRS, they were met with, coaches provided some coaching on that to help them improve over the next year. So we hope to see improvements going into the next school year for this. That same process was followed with all of the other measures that were included on the previous slide. As the data came in, they were analyzed, the coaching happened among teachers and directors as appropriate. Survey results are one of the first things that we get that we can report on with confidence. And so surveys of teachers, largely highly positive numbers there in terms of support for the program. They appreciate the supports. They found the professional development valuable. And then these students are too young to survey on their own, and so we ask parents how they feel about it. Again, overwhelmingly positive results from the parent survey. They're happy with the staff, they're happy with the activities for the children, and they say their child enjoys going to pre-K on most days. Our next steps for this project, we are in the process of completing and validating the databases with which the statistical analyses will be conducted. This includes the nitty-gritty details of diving into, do we have attendance data points for every student? Do we have consent forms for every student? Where do we have data, missing data that we can impute? Where do we have data for those students? And then conducting the statistical analyses. We're on track to provide the evaluation end of August, beginning of September timeframe, which will have the analyses that you're looking for in terms of teacher retention rates. Do we see progress in that area or not? As well as do we see progress for these children within these classrooms compared to some control classrooms?
If I may ask,
Ma'am.
looking at the surveys and the outcomes in terms of the responses from the parents was awesome. How did you get the parents to participate?
Begging. Actually, parents, once we found the mechanisms to reach the parents, they generally are pretty happy to participate. For focus groups, we did provide a small financial incentive. For surveys, we asked and hounded all the way through.
Sounds great. Thank you.
Sorry.
Okay. In conclusion, we want to thank you again for your long-term support and appreciate additional support because this has been a great investment. But as many of you all know, it takes a lifetime investment as it relates to children and families. And really glad again the support of the county, but also the community, and particularly some of our partners. So subject to your question, that's all that I have, unless you all have anything for us. And again, we just want to tell you all that we appreciate you, but also appreciate Commissioner Martin, who helped spearhead and lead some of the early care and education work in this particular community, along with the superintendent. Yes.
Commissioner Bessie.
Yes, thank you, Mr. Chairman. Thank you, Dr.
Yes.
For coming this morning. As you may recall, I was not present on the commission when this project was designed and initiated, so I'm a bit less familiar with some of the parameters than my colleagues. So forgive me if I'm asking a question that was clarified at that time.
No problem.
You gave us some information on the pre-K child care health assessment and enumerated the number who would miss this screening, that screening.
Correct.
Can you tell me about the the population health care form coverage? Roughly what percentage would be enrolled in Medicaid, what would be covered under private insurance, what would be covered under the ACA marketplace. Do you have that data? What percentage are still uncovered?
Yeah, that we may not have specifically, particularly as it relates to the private child care. Now, the Family Services Program, they do keep that because they're required to have a medical home for their children, where the school district and private child care is not. But what we did different with this project was treated every child the same. So we should have the data on that health information, so we'll get that for the evaluation as far as the Medicaid.
And the reason I ask in this context is because I'm basically trying to identify the degree to which the absence of particular screenings are because they were not available on an affordable basis to the family involved, or whether they hadn't, taken advantage of programs, didn't know about them.
Yeah, statistically, it's normally based off of parents just not knowing. Many children don't do initial health screenings at ages 4. They wait, nor do they use dental. So in most cases, the first time a child gets a dental screening is normally in a program, not by their parent. So in the case of, say, Family Services, those families likely got the dental screenings because that's a core requirement. But here in private child care in the public schools, it's not a requirement. But in our particular cohort, what we found is that we wanted to make all the families have the same type of access. So we're going to take the role of following up to make sure that they get those screenings. Yeah. And that's where we have family engagement specialists that Family Services handle, and they're responsible for following up with the parents to get those health screenings.
If you can obtain a little bit of the background.
I sure will.
Thank you.
But thank you for the question.
Thank you. The other question I had is about what appeared to be some difficulty filling all the slots. Is this a matter of obtaining interest from licensed providers that are out there, or is it a matter of parents on an individual basis for their child not being interested in being involved?
Are you referring to children's slots or teachers?
Children's slots.
Oh, children's slots are there. The issue is the staffing. We have centers in our community that actually have empty classrooms because of staffing. But there are plenty of children and large waiting lists in our community. It's just getting the staff up to par to kind of work and fill the classrooms. So the issue is definitely not the children, it's not the parents' interest at all. And also there's an affordability issue as well. Child care has really become very expensive. And right now in our community is second to your mortgage. And in some populations it's before your mortgage. So if you have 2 children, you're spending more in child care. And if you have an infant, you're probably spending more in child care than you are for your rent or your mortgage.
So,
Yeah, just to Commissioner Bessie's point, I mean, I just looked at your slide. It says you got 404 of 540 funded slots of children served. And you're short, 136, and it says lowered enrollment due to recruitment challenges across all programs. And basically of actuals, I'm not sure what the 404 or 481 students actually served means, but it looks like that's where Commissioner Bessie's getting. That looks like we're short on kids.
Let me go through that, and it could be because of turnover. If I can tell me which slide it is.
It's way. Keep going back.
it's
Keep
it's
going.
on this slide in the presentation.
There, whoop. Yep. Yes, right there. And you see children served, 404 or 540, those 3 statistics.
You want to answer that question?
So this is largely based on, when we look at the 481, it's based upon the actual slots of classrooms that are open and available currently in the project, which of course is opposite of 540. But of those 480 slots, we have 404 children who were consistently and regularly attending. And as Dr. Finney stated, much of which the reason why, and as it states here, there was some struggles for our centers to open classrooms, which of course would then add to the number of children that would be in those slots, largely because of the staffing crisis. So many of them were not able to open up those classrooms so that we could then recruit children into those slots. So the children were there, the classrooms were there, they just didn't have the staff.
Okay, that was Commissioner Bessie's point.
And to
we have
follow
a staff shortage is why we have a children shortage.
And to follow up on that just a little more, and pardon my larger areas of ignorance, but you're not saying that there are only 481 slots available across the board for children to go to pre-K in Forsyth County. So what is the limiting factor for your pool of
30,
potential?
30 classrooms. This
Yeah,
is a.
this is just focusing
pilot
on 30
project,
classrooms.
30 classrooms.
Right. And what, all right, so how were these 30 classrooms selected?
Okay, good question. Well, with the private providers, that was done through, we advertised. We also did a rigorous test to make sure you were licensed, you fit a certain criteria. Some of the other criteria was being part of the state system of MC Pre-K. And part of that reason is because we're able to infuse additional state dollars if you're part of an NC Pre-K program. Then we had a partnership with the public schools, and we allowed the public schools themselves, between the superintendent, they selected the classrooms that are in certain locations, and then family services themselves, they selected classrooms as well.
So you had a screening process to
Correct.
select the classrooms, and once you selected the classrooms for the study, then you're stuck with those classrooms because you have
Well,
to.
not necessarily, because some of the between all three were short-staffed. So sometimes we actually had to switch some, because even the school district had some issues with staffing. Family services had issues. So it's really across the board. It's not just the private childcare industry in our community. It's the public schools, family services. So that was why there were some changes as well, where we might have took less or maybe had more school district because they were ready at the time.
So what we're seeing here, if I can just kill this horse completely,
Okay, no problem.
is we're seeing a staffing problem that is representative across the employment sector, across the industry, if you will.
Correct.
And that manifests in the case of the 30 classrooms with an underutilization of the total slots. And
Correct.
it's a staffing problem. Okay, thank you.
Thank
Well, and by the way, Commissioner Bessie, there was an intentional oversampling of private independent centers simply because we had no data, but there was a belief among those working on this project for about a year was that that's probably where we had the least performance in terms of readiness coming into public schools, was in the private providers, because there was no data available. We had data available in the NC Pre-K and others, but the NC Pre-K was oversampled simply because of poverty. I mean, the high poverty piece on that, and that was a piece. So the idea was that it'd be helpful, we can do a little the proposal itself really got into where those percentages kind of came from. That's why the public schools, which serve the most, are more underrepresented. All of those groups did not have their components to the project. All of them did not have it. No group offered everything. Public schools probably got the closest. They were kind of missing a good, strong parent involvement component. And family services, that's why family services took the lead to provide that for everybody. So it's a kind of a long, involved issue, but there were 29 lead teachers. And so we had 29 out of 30 classrooms. Of course, I don't know if they were there. They probably weren't there, obviously, on day one.
Correct.
But you got to 29 of the 30 classrooms, and I would assume your typical average is 15 per class, so you were probably looking at you'd been a full boat if you were around to 450, so maybe you were on 16 or something, I don't know what you used for that, but 16 would be much closer to the 481
Commissioner Ryder,
slots.
I just wanted to share that a couple of our classrooms were not at 15. It was kind of based upon the square footage in that center. So some may have served 8 children or 9 children in that classroom, just based upon the square footage of the classroom. So it was based on the licensing capacity. So there are some classrooms that are participatory, however, the number of children are not at 18. However, they showed to have the largest need. So we wanted to make sure that we continued to serve them in the project because they did, in fact, have the largest need when we thought about our private providers. So we kept them in the project, but then continued to recruit. So they were at different points in the project where we had 31 children in the classroom. 31 classrooms recruited, because we wanted to also, as we were serving, making sure that we were serving the max number, our allotted classrooms, we wanted to also make sure that we had opportunity to serve as many children as possible. So we are continuing to recruit children because we still want to make sure we get as close to that 540 as possible, but we didn't want to put out any classrooms with such high needs in our private sector simply because there wasn't enough square footage in their particular classroom that was needing to be in part of this project.
I got you. Other questions, and I have just two little summary things. Other questions? The other part, when you get your results in September, it'd be great if whenever we kind of do these about every other month or so, it'd be great if we could have the results. I mean, this was a nice teaser for kind of how you got started. But the real interest is how your first year results, what they turn out to be. And the second question really has to do with money, how your dollars are spending, because we're fortunate that we were able to extend to all the ARPA participants who they're not getting extra money, but to be able to extend the time, in terms of spending the dollars. So I was really pleased because it gave you an opportunity to get through 2 full years. How are your dollars spending in terms of getting through this next year completely, as including evaluation cost and doing all that? I'm kind of curious how your money's running.
Oh, thank you. We're actually on target with the spending, and some of it we have some supplemental dollars that came in, particularly from the Reynolds Foundation to help support the parents. So another component to this is a program that works specifically with the dads, something that we didn't mention in this particular program. We saw that was necessary in the school district and the private child care. But also as an agency with Smart Start, we also supported with some of our state dollars to make sure that we can do the entire 2 years. So we actually have some staff who kind of supplement who aren't part of the grant to help make sure this is successful. So financially wise, we're doing pretty good because from an educational perspective, we saw that it was critical to have a full 2 years because the first year was extremely challenging, especially given the climate as it relates to education and private child care. But also we had so many that were closed. In our community, on average, we get 1 or 2 that close every 2 months. So what we've been focusing on is 2 things. One is trying to reopen centers through another project, but also trying to keep some open, but also doing this same project at the same time.
Yeah, well, one of the real issues of looking at what happens after this second year is over is a big issue because you're not going to have your second year evaluation done, it looks like, on your time frame till September of the following year, until September 25. So, and of course, funding decisions and everything will have to be made, at least anything we do is made in the spring. So just kind of, that creates the hope is to figure out if this worked, to figure out a better sort of way to do this across the county.
I agree.
But I'm absolutely, at least I can only speak for myself, but I'm not going to be willing to support 25, 26 in any way without the results of the 2-year study. So that does create somewhat of a timing
Maybe you can
problem.
help with that study timeline.
So one of the things that the NCE, no-cost extension, did allow for is we actually will have 2 full years of evaluation work. As originally conceived, we were going to be able to evaluate year 1, and then we were going to be able to look at August, September, October of year 2 and produce a 1.25-year-long evaluation report in December timeframe. That was the original plan. With the no-cost extension, we're able to do a year 1 evaluation and a year 2 evaluation, and then do some summative across or longitudinal across both of those. We're actually scheduled to finish the year 2 evaluation in July timeframe of 2025, which I recognize is beyond the spring deadline. What we will have for you in terms of the spring deadline for looking at budgeting, we will have the year 1 results, and we'll be able to develop some pieces from the first semester of year 2 to say that, yes, it looks like year 2 is on track to be as good as, better than what we saw in year 1. Unfortunately, with a lot of these measures, we're looking at growth over time for students. And so, for example, one of the data points is a beginning of year, mid-year, and end of year assessment of the child. We can't do that end of the year one before beginning in April. And then we have to done the process of consolidating all of the data. Do we have 3 data points for this child? Do we have 2 data points for this child? What do these results mean in comparison to the number of days that they attended? Were they a regular attender? Were they, come once a week? We have to run all of those analyses. So I can't finish that work until we get all the data points and validate the data set. I will say that the September timeframe for the year 1 report reflects the challenges we've had in gathering data, building systems and processes. I've done a lot of first-year implementations of grant programs, and if they don't have major challenges in the first year, if they tell me they don't have major challenges in the first year, I'm very suspicious. We've had challenges, and building those systems has taken about the normal amount of time, longer than anybody wants, and enough to kind of put us on a delay for the first year. That's why we're cruising towards September for this evaluation, but we anticipate July for the year 2 evaluation.
Great. Thank you very much.
So will the July be fit that date?
No,
Or a little
but
bit? Okay.
she commented that there may be some indicators from the spring
Okay.
that can be looked at.
Okay.
But
Okay.
got it.
All right.
Thank you.
Okay, thank you.
I mean, it is hard work, and there's a whole lot, I know there's a whole lot more that's going on than what's in this
Okay.
report.
All right. Thank you, Commissioner.
Thank you.
Thank you, Dr. Finney, and I did want to acknowledge, I see you have many staff and some board members here with you as well, so thank you all for being here. Our next discussion item will be led by Deputy County Manager Damon Sanders Pratt. The board directed us through the budget process to conduct a fire study, and Mr. Sanders Pratt is going to try to provide a proposed framework so that we can get board direction on what we will be studying this upcoming year.
Thank you, Mr. Manager, Mr. Chairman, and Commissioners. Today I'm going to go over, hopefully briefly, a plan, some structural challenges that exist in the system-wide look at fire, kind of as the result of a board-directed initiative. And it's really trying to look at the viability of the fire tax district system-wide, kind of versus looking at it at individual district level. And then it will, some of this was inspired by the overlay district conversations that came from the contract. And so when we were talking about Section 15 of the contract and ways to fund the fire system, some of the chiefs in conversations with board members suggested that there may be a study group to look at a funding plan if that was the case, if we funded it using the overlay district. And then also some of the structural challenges of a fire tax district system that was really developed to support volunteer fire systems, rural fire, that are maybe just through the change of the community and society and the way our businesses are made with less third shift work for people to be available to work on first shift as volunteers. It's become a challenge to have volunteers in the system. So they're moving toward paid staff, but does the tax base really support that kind of thing in the long term? So hopefully this really just talks about some of the structural issues and then maybe how to move forward to look at the viability of the system-wide fire tax system. So this is why I'm standing here. There's actually a board-directed initiative, number 19. We were basically directed to begin conducting a fire study to look at the overall system and the equitable level of fire in the system. So this is a look at the fire tax districts in Forsyth. So in gray are communities that are not a part of the fire tax system. So you've got a little bit of the city of King. Rural Hall has its own fire department, as does King. Winston-Salem is also not a part of the fire tax district system. The town of Walkertown is not. They contract for fire. Kernersville has its own fire department. And then in gray down here, you've got a little bit of High Point that is annexed into Forsyth County. And so the rest that are in the different colors are tax districts or service districts that are in our fire tax system that we operate for volunteers, basically. This is that same map that shows in the colored districts, if you take out the gray, what the rate is in a particular district and what that yields for that particular district. And so you can kind of see the range, maybe if you look at the west, southwest, where you have, departments that, like Vienna and Mount Tabor, that serves 2 districts that are about $1 million. And then Louisville that serves 2 districts, so that's about $2.2 million. And then you've got Clemens at 2.7 that also serves South Fork, a small portion of that. And so that's basically $2.7 million right there. And then you go to the other side of the county, and there are other communities where there's a 10-cent rate, and that generates $479,000 in Northeast, which is commonly kind of referred to as Walkertown. Then you've got Blues Creek at 11 cents. That brings in about $500,000. Now, Piney Grove is on the east and has $1 million budget, but their rate's at 14 at the moment. So just to kind of give you a look at the different regions in the county, the rates, so you've got relatively low rates, 8.5, 9, and 8 that have larger yields. And on this side of the county, you've got larger rates at 14 cents rather, 12, and 10 that don't generate as much as in the other districts that have a healthier base. There's also an overlay district separate from the individual fire tax districts that was established a couple of years ago. And so on here, you've got the green is the actual overlay district. So again, it excludes the other colors. So gray would be Winston-Salem. It excludes Kernersville. It excludes High Point. And then these other districts that are in blue are not in the overlay district, which is basically the town of Walkertown and the city of King, but they've agreed to pay to participate. So we put them on here in blue because they're also part of the system because they've paid the equivalent amount to participate, although they're not in the district. And then Rural Hall also was not in the district originally, but with a changeover in policy, they have decided to participate, so they are in green here. So they are part of the overlay district. To kind of show again some of the challenges, in Clemens, you see they have a tax base of $3.4 billion. Louisville, $2.4 billion and what that revenue results in. And then Vienna of $1.1 billion, and that gets them basically $1 million in operating revenue. Then on the flip side, you've got other communities where Griffith is $289 million, $290 million, that generates that much operating revenue. Salem Chapel, $107 million, and what that generates. So this is just another look at that on the same page, just to compare the two. And so one of the challenges results in, and these are the rates that are generating these numbers. So if we look at this line here, the lower rates at the bottom, higher rates at the top. So, and then the numbers that are next to each service area for departments represents the tax base. So this is the highest tax base, second highest tax base, third highest tax base, fourth highest tax base. But then you'll note that they have the lowest rates. So intuitively, that probably makes sense. And then up above, you've got a Hornytown at the 13th highest tax base out of 17. Salem Chapel, the 16th highest. Piney Grove is kind of the outlier at 6th with a relatively high rate. But Union Cross, the 11th highest tax base. Gumtree at the 17th highest. They have the higher rates. So they have the lower bases and the higher rates. So just to kind of show that those areas that have the healthier tax bases also benefit from the lower rates. The average rate for all these departments would be 11 cents. So here's an example or a comparison just to kind of show more challenges that at 8 cents in Clemens, it's generating $2.7 million just in that tax district. In Mineral Springs, at 12 cents, it's generating $297,000. So what I'm really trying to show there is that if you have a $150,000 house and you pay 8 cents in Clemens, you get a pretty robust level of service, right? If you pay on a $150,000 house, you're paying 12 cents, it generates less revenue, so you're gonna have less staff, able to support fewer stations. So the owner of that home is paying more money on their tax rate, but they're getting less just resources just because of the nature of what the cost. And then I come down here to give some other hypotheticals that in Salem Chapel, 1 cent gets you $10,715. So for them to have $297,000 like in Mineral Springs, the homeowner would be paying a 27-cent rate, which you can't do in a tax district because they're limited to 15 cents. And then the homeowner would be paying $416 for their fire tax, whereas today, I think I calculated, they pay about half of that. So I don't want to waste your time as I'm looking for it here. $210 today. And then to have an equivalent revenue source as does Clemens, if you were in Salem Chapel, you'd have a $2.54 tax rate for a homeowner. So again, if you had a $150,000 house instead of $210, you pay $3,814. You really just couldn't do it. And at 27 cents and $2.54, well exceed 15 cents limit for fire tax districts.
Before you leave that slide,
Yep.
of course, one of the big issues is with that $2.7 million budget in Clemens, they got a whole lot more people that they're serving in households and value than is being served in Salem Chapel. So it's, I mean, it's really not,
That's
it's really not,
true.
it's not an apples to apples issue because you don't need $2.7 million worth of resources in Salem Chapel, in order to take care of their fire needs. Now, it is true that to have a fire station, there's a certain amount. You got to have
That's where I'm
some
going.
trucks, you got to have some people, you got to have equipment, you got to have training, you got to have it. So there is a base that just to open a fire station, you've got to spend X amount of money. But the number of staff, the number of trucks, the number of things is not necessarily linear. And when you've got the money, you do more, and when you don't have it, you do less. And that's why Salem Chapel is probably Salem Chapel and Horningtown is close you've gotten to a volunteer fire department, because they still have volunteers, a lot. I don't know, I'll characterize that, not a lot, but they have volunteers and they're paying very few people. So, and that's where that's the only way they're able to survive. But yeah, there's lots of tax equity issues, service equity issues, and it's a big problem, big issue.
Right. And so I agree. And where I was going is that there are some basic things that you have to have, like you just said, to have a fire department.
Yeah.
So here at firefighter apparatus or trucks, they're running $750,000 to $1.2 million. So no matter how big your budget is, whether it's 272,000 Mineral Springs or 2.7 million in Clemens, the truck costs what it costs.
Exactly.
A station that was just bought in Rural Hall or built, $6.2 million. Turnout gear, they're all paying the same thing for turnout gear. You see radios, cost of radios, and then to have personnel, which creates a stronger system in that you are guaranteed response when you are paying people to go. So that cost, they all would have to pay if you're going to have people, regardless if you have $150,000 or $15,000 budget, like in Salem Chapel, or $2.7 million, these are your costs. So it's a structural challenge for some. Now they are generally moving away from more of a volunteer system to having more paid people to improve the service level, but that becomes a challenge. Yes.
The Rural Hall Station, did they not receive funds from the General Assembly for that new station?
Yes.
Do you know how much?
I don't.
Okay, that's fine.
Rob may know.
I think maybe no.
It's Chief Smith from our county fire department.
Repeat the question, please.
Pardon?
Could you repeat the question, please?
Yes, the Rural Hall new fire station, did it not receive General Assembly funding?
Yes, it did.
Do you know how much?
I do not, the total number, no, ma'am.
Okay.
But we
thank
can
you.
find out.
Yes.
That's okay.
Find out.
And of
Well, it
course-
makes a difference.
Yeah, and we've got trucks that are paid for by the General
Right.
Assembly, and we got trucks that we've paid for out of ARPA funds. We got,
Yep.
there are other sources that have been trying to provide some equity in part of this, but
Right, and that largesse has happened a lot lately with ARPA dollars and other funds being available. That hasn't always been the case.
very true.
Okay. So this is a look at the fire tax districts by population. So to your point earlier, you've got a community like Clemens at 25,000, Louisville at 16,000 people that are being served. And you've got other places like Mineral Springs, which also serves the service district, and Forest Hill. So that's another 200, maybe about 4,000 people. Salem Chapel serves 723 people. So you can kind of see the healthier departments generally have more people that they're serving. In the east, Piney Grove serving 7,600 people. Beeson's at about 4,200 people. So it just really varies. And some of the healthier departments have larger populations that they are serving that can support the fire service. This is again a listing of the fire departments and the populations that they serve. And so you can kind of see, again, some of the healthier ones have the larger populations that are being served. And then down below, now this is just Gumtree in Forsyth County, but what their populations are and some of the smaller departments here with lower populations. So there is some tie between budget and population. Right? Now, this slide I almost didn't include because there's a lot of caveats to it. So the ones that have asterisks next to them have some significant service areas in other communities. And I really asked the chief, and he did, to limit the calls to medical and fire, although they have other calls, some sizable numbers of others, from hazardous material things to maybe tree in the road, to flooded roads, to a variety of things. But I really just wanted to show calls, similar calls for each department in Forsyth County, and then the cost per call. But again, until I'm able to really kind of clean up the data for the asterisk communities, I'm not sure how helpful this is necessarily, because some of these other departments serve other communities. But you can see in Forsyth County alone, kind of what they serve just for medical, just for fire, although they do have some other calls that they serve, and what that cost would be just looking at their budget figure in Forsyth County. Although some of these other communities, again, with asterisks, receive revenue from other communities that they serve as well. So the total tax district base is $12.9 billion. The total tax district revenue that generates for all the departments in the fire tax district system is $12.4 million. And then, as I noted earlier, the average tax rate is just over 11 cents. An equivalent overlay rate, if you look at the overlay district and substitute that to generate 12.9, to have a tax district revenue of $12.4 million using the overlay district would be 9.7 cents. This is just another look at that, is if you took all these colored tax districts and you added up the revenue generated in each one, you'd have $12.4 million. If you did the same thing using the overlay district, which is the green areas and the blue that are paying the equivalent amount, to get $12.4 million would be 9.7 cent rate. So again, here's another same look at we saw earlier of the tax rates. And so at 9.7 cents, what I note below here is that would be a decrease for residents in 12 of the 17 department service areas. So everybody basically below here would not see a decrease, but everyone above Beeson's would see a decrease in what they actually paid. And so I say 12 because I didn't really count. Triangle doesn't actually have a department. It's served by other departments, 3 other departments. In Winston-Salem, if you look at their taxes and what they pay for fire as a percentage of their overall budget, they actually are paying 18.5 cents of their 72.5 cent rate on fire, which exceeds the 15 cent limit. So they couldn't do that if they were a volunteer department. And Kernsville is actually closer to 27 cents of their 58 cent tax rate. So both, again, exceed the 15 cent rate. And so as departments kind of evolve from volunteer to paid, if they're heading in this direction, you can't get there under tax district system.
Could I interrupt briefly?
Yes.
Do you have equivalent data on the spending per capita?
I don't. I could get that.
That would be useful to compare. The presumption would be that they're paying for a higher level of service, either through equipment or through personnel density or a combination thereof.
Are you talking about between our districts, or you're talking about for like City of Winston-Salem and Kernsville?
In this case, I'm talking about City of Winston-Salem, Kernsville, although it would.
Gotcha.
I think it might be useful to have the data for our volunteer districts as well.
Mm-hmm.
I
I can get that. So some existing strategies that the county has done over the years to try to help with the inequity that's kind of structurally there is that the overlay district system was created, which has expanded the support suppression program that the county operates, where we just had one support suppression unit, which we call 109, and now we've added 2 more, and that basically they help all the volunteer fire departments to get like 10 people in 10 minutes, kind of this goal. So we'll send people from our fire department to help them get that number. So we've done that. The overlay district has acquired the fireworks software that departments used to buy, Now, the county uses the overlay district funds, at least this last round, to purchase the fireworks software instead of taking that out of the department's budget, and they can use it for other things that they find are important. And then there's the Vienna model, which was a system where you have county employees who supplement the Vienna volunteer system. So they're actually county employees who work in Vienna, and they go on calls as well as the volunteers do. So that's a guaranteed number of people that are there that can respond that are actually county employees. And then there actually will be this kind of once-in-a-generation reval opportunity that, as John talked about, maybe it was a 40% drop in some communities, maybe in their rates, to get to revenue neutral. So that also gives an opportunity to have more cap space where you have one department that's already at 15, so they can't go anywhere. That's likely going to drop a little, which gives them another opportunity to ask for increases. So that will be helpful. But again, that's been a once-in-a-generation thing. As the departments, again, move up toward that cap, that pressure's always going to be there. And some departments, likely in the districts that don't have as healthy a tax base, may not see as large a decrease. Like the largest decrease is going to be in the communities that probably have the most growth and tax base increases. So potential next steps is something of a blue ribbon committee, which really kind of got from the conversations that the chairman and some other members had with the departments, and that who could be on that committee to kind of look at a funding plan and the system generally, and maybe the viability of the current system and how that operates and better ways to even do that. So I just suggest some designees from the Fire Association Board leadership, maybe 4 of them, county staff, so somebody from the manager's office, budget, fire, EMS, 911 that can help with information in that regard, and a commissioner or commissioners that may want to participate on this as well to help look at data on the current system and the overlay district and how the current system could be better or what a overlay system would look like countywide. Look at the current consultant data, basically comparing strengths and weaknesses. It will talk about the evolution kind of toward paid professional versus volunteer, what that means, apparatus, where they are, how many there are, how old they are, and then where stations are located. If you have a tax district, you have to have a station, and you have to put equipment in that. But if you combined and you had a kind of a unified district, that may limit the number of apparatus you need. If you combine 3 into 1, then you can put the right stations where you need them, versus now you can have a shard of a system, a very small piece, but that tax district has to have a station. Whereas if you maybe took South Fork and Clemens, and now they are one, perhaps they maybe could have one less station if that district's considered one. But right now, if you just have South Fork, it's got to have a station in it.
Yeah, can I interrupt you 1 second?
Yeah.
Yeah, that really struck me because I was not aware. Look, it's your slide of the population with the population by, with the district. It doesn't have a number, but it says total population by fire district. I was really surprised to see with what you just said, that if you have a fire district, you have to have a station. South Fork has 58 people. That's the population of the South Fork Fire District, 58, and they have a fire station.
So Clemens operates 2 stations.
Yeah, well, I'm assuming one of them's in South Fork.
Well, or used to be.
So what you just said about having to have a fire station, have a fire district, then is the South Fork Fire District disappeared? Has it been merged into the Clemens District?
Well, so those 2, it does serve that. They do have 2 stations. I'll need to look into that again for that particular one, because it looks like, when the city annexes in an area, they had to help pay for the station that was there, that still remained with the volunteers. Because I think they may have annexed where the station was, or Clemens did, but they do have 2 stations, and they've got these 2 districts, and Clemens still has 2 stations. So one of them, it may be in the Clemens.
Damon, Chief Stiers is in the audience. Is that a question you can answer?
And is there a contract with Winston-Salem or do they pay them extra money? Because they are obviously right in the middle of the.
Yeah, probably the best way to answer that is So to Damon's point, when you have a district, you have to have a fire station.
Okay.
So what has occurred over time is, like if you look at the Forest Hill, Mineral Springs, Forest Hill does not exist, but Mineral Springs has taken over that area. So functionally, the Mineral Springs Fire Station is serving Forest Hill. For us in South Fort, Clemens and South Fort merged. So there's one department for that district. Now, the function of fire stations is a basic of coverage and service delivery. So the reason Clemens has 2 fire stations is because of how broad we are. In other words, like Louisville has 2 functional stations. One's in Louisville area, one's in the West Bend area, but they have the 2 stations that function. Same thing for the Northeast District with Walkertown. They have different stations so they can get the coverage area because a station can only cover about 5 miles, or 5 miles is the rated area. So if that helped you with the answer, we do not have a contract with Winston. The South Fork area still exists, and this is the fire tax district. So that's the district from which the revenues are coming from. It has no function of where the fire stations are. But when you
I'm
go
just,
ahead.
I'm just kind of going on, help me understand now, if you have a fire tax district,
Correct.
you must have a fire station in it.
No, if you have an insurance district, and the insurance district covers multiple fire tax districts. That makes sense. So in other words.
Yep, except we don't have a map of insurance districts.
No,
We
they're
we have a map of fire districts.
Right. And it gets, they get mixed up a lot, and it's very hard to understand, but the fire insurance district has to have the fire station. Fire taxing districts are where you're deriving your money from, and a lot of the fire tax districts are covered by other areas or other fire stations. Like Triangle does not exist, but it's covered by Beeson's or Union Cross and those things. Does that make better sense?
Yeah, yes, yes.
A lot of devil in the
because I was
details.
having,
The South Fork District, what was originally, how much of that is in a city? Is there any of what the old South Fork District in Clemens Town?
There is, I'd have to look at a map, but South Fort is very, very, very small. And it's mostly Plowboy Lane, that area, those really rural areas of that area off Jonestown Road and McGregor Road.
The
those
major
areas.
part of it is in the city of Winston?
It's not in the city of Winston, and I'm going to bet it's probably in between the city of Winston, village of Clemens, and it's just a little area that just has not been annexed by either one.
I'm familiar with the area, Commissioner, and basically he just described it. It's little wedges of seemingly random unincorporated land that are not inside Winston-Salem, but they're not in Clemens either.
Well, if it was not, is the reason for that, the moratorium on annexation was in place when that was all changing over?
I think it's because they didn't meet the population density requirements for annexation at that last large annexation before the moratorium went on.
Okay, well, I didn't realize that. I thought a big portion was in the city, so I didn't know that.
Most of that area is in the city of Winston-Salem limits.
In the city, but
I could take you out and show you some of the little roads that go into the no person's land between Winston-Salem and Clemens. It's not served technically by anyone on certain municipal level services. So,
well, all of that South Fork area, all of the fire district area of South Fork, is that served by Clemens? Every bit of it?
Yeah, we
Well,
functionally,
to do that, you're coming into the city to do it.
a lot of times we're going through the city to get to it because functionally of the
That
insurance
is-
district, we have to serve it.
Some of that is, I won't say all of it, but some of that is inefficient because there is, I believe that some of the fire stations near that area of the city is nearer than South Fork, Clemens, so there's some inefficiency there.
Yeah, and that's
I would
actually a great point. And what we do, especially with, there's a fire station on Somerset, is work with them to respond because they're a lot closer. But functionally, as far as the insurance district, we are responsible, but we work with the city to get the person service quicker than we can come from James Street trying to get out there. You're right.
And there could be as few as 20 houses.
Yeah.
In that area. I mean, that would be, if you had 3 people per household, that would be 20 times 3 is 60, and you got 58 people. Or it could be 25 households. That'd be, I mean, and those houses could have been built after the annexation was stopped. I mean, you got all kind of things.
There's something there that is not, it's not clear to me, but it's something that is not right too. I'm not sure what it is, but there's something there that's not exactly as it should be. There's some inefficiencies, and that's one of the kind of things that needs to be addressed.
And part of, thank you, Chief Stires, and part of what this group could look at again is, support suppression, what we do, people, what we're doing it with, grant opportunities using what we have in fund balance right now for the overlay district that could be provided to departments. Look at the benefits and drawbacks of the system that we have now with 25 tax districts of a variety of types, plus the overlay district. Kind of look at the benefits and drawbacks of an overlay district system, and then look at who's doing it, what's been their experience, and can that be improved upon. Now, I didn't mean to leave a date there, but just kind of the formation of a committee. And the things that they could deal with would be Tridata's findings from the 2016 study, the current fire system, the overlay district system, as I noted in the previous slide, and then committee conclusions, perhaps in April of 2025 or whenever that the work was done. And that's really kind of it as a setup for the potential funding plan Blue Ribbon Committee on fire. And I'll be glad to try and answer questions, or I have Chief Smith here, or there's also Chief Paul Walker from Piney Grove, and Chief Bottoms from Walkertown are also here.
And we're really just looking for board direction of, are you okay with these next steps? Because this is what we would be working on throughout this year.
I certainly support the committee. When we met with some of the firemen, that's what they requested, was a committee. So I certainly support your next steps.
Mr. Chairman, I had one question for our chief in context of the committee. Would you find it helpful to invite a couple of your professional colleagues from Winston-Salem and Kernersville to sit in as committee members?
It wouldn't hurt. It would be good.
Okay. I'd suggest adding that then.
Yeah, it's a big committee, and I could argue you could maybe, I mean, I like it, like the idea. I could maybe argue that the timeline could be, we could probably have the committee selected by August, selected, and then try to have a first meeting maybe in September, and then maybe move that up. We'll try to move this up a little bit. But I mean, I like the idea of some date certainties to finish parts, and that's been our problem. We talk about it at budget time, and then we don't talk about it again until the next year's budget time. And we say, oh, we really need to work on that. So this is good to establish some dates, and it probably doesn't matter if it can stay the same, but I think the dates, but I think we definitely need to move along on that and get busy. We just scratched what you've just described today is scratching the surface. What Commissioner Linville mentioned, there's probably more than one such irregularity like that's going on, and it's a matter. And I think adding, I mean, I'm not so sure that Kernersville and a Winston-Salem rep would be. I think it's great for them to be on if they're willing to sit through some stuff they probably don't care about. But I think they'd be a great resource, and if they're willing to do it, that'd be really nice of them to do that, and they would probably offer some. They'd offer some of their frustrations. They got them too. You got lots of people driving through each other's fire districts but of course everybody's responding. I mean, everybody's responding to the fire, but different trucks are driving through different things and so forth. So it is a complicated matter. And I think reading the study, the Tridata findings to begin with, sets the stage, because I kind of remember that from about 8 or 9 years ago. It really talks about some issues about equipment and that very issue, duplications of certain, where they're, like you, just like we heard about deserts in pre-K, we got some desert sort of fire areas of sorts that get less, and then we got lots that are overloaded, and yeah, it's a lot of stuff to look at. But anyway, I appreciate you collecting this together. I think I personally think it's a great idea to do this, and we need to get on it. I agree.
And we'll absolutely work towards getting the committee formed, and the committee can solidify some of the dates. We just wanted to throw something out there so that you see we're serious about it, we're going to hold ourselves accountable to it, and then we'll just look also for board direction on if there's, one of two of you that would want to sit on this committee to let us know.
Okay.
Through the wonders of technology, Chief Smith already found out that Rural Hall got $3.8 million for their $6.2 million station.
Thank you.
Say that again.
That's helpful.
Rural Hall got $3.8 million toward the $6.2 million.
Over half the station.
Thank you.
Thank you.
Thank you. Our next discussion item is, did you need a break?
We'll ask for a request of a 5-minute break.
No problem. Thank you.
Quick 5-minute break.
Thanks.
Good, I kind of need that. Close to 5 minutes, so we're back on schedule, back on.
Thank you, Mr. Chairman. Our next discussion item is in regards to PAYGO projects, which was another board-directed initiative for staff to propose a process. Kim Bussey from our Budget and Management Office will review this item.
Good morning, Commissioners. Thank you, Chantel. I'm here today to begin a conversation with you about PAYGO, so do look forward to having some direction for where we go from here. Oops. But I thought we would kind of have a quick review about what PAYGO is and how we're currently using PAYGO funding in the county, and do a brief review of some peer communities for what they're doing, and then take a look at maybe some proposed ways forward, and then hear from you for how you'd like to proceed. So PAYGO financing is funds that are currently available rather than borrowed. Again, there's no associated debt with this funding. It is a capital financing tool. So I think, some options for financing are general obligation bonds, two-third bonds, limited obligation bonds, sale of grants or assets to fund capital projects. In Forsyth County, PAYGO is the fund balance. It is available after the fund balance policy is applied and some of these restricted uses are applied. You may remember this image on the right here, our CFO, Terry Goodman, back when we had a discussion with you about the 2023 PAYGO and about the proposed projects and to establish that capital projects ordinance. The CFO went over kind of how this calculation is derived for the amount of PAYGO available each year. So the amount at the bottom there you see available for PAYGO. And Terry went over the fact that there's a change in the fund balance, minus the required allocations for fund balance for restricted and committed and assigned. And then our internal fund balance policy, which requires 14% available in unassigned fund balance.
Before you leave that page, could you talk a little bit more about the committed and assigned fund balances, what they really are?
Sure.
Yes, the committed fund balances are where the board has taken action to set aside fund balance primarily for us, that is the debt leveling plans. And that makes up the majority of that number. And then assigned, money that is used to balance the next year's budget or any other management assignments that we may just identify as we close out the audit where we need to set money aside. Sometimes there are economic development incentives where the contract actually has expired, so we don't have an encumbrance to roll, but we know the commitment is there by the board to pay that in the future. So we'll make an assignment for those monies.
I'd be real curious in seeing what constitutes that 16.3 million now. I mean, when you get a chance to do that, that's not a small amount of money. And it's really not an economic development incentive because those are just deferred. We have just deferred taxes. I mean, this is not a money exchange in hands on an incentive. So we're not collecting some taxes that are going to be levied in the future, and it's really no money exchanging hands. It's conditional, and if the company didn't get it, we wouldn't even have any of the money. So I'd be real curious what that 16.3 million of assigned fund balance is. I assume some of the PAYGO projects of XYZ PAYGO from 2016, could be a part of that, I assume. But I'm real curious what those are. I'd love to see a list of that.
I can send that to you. The vast majority of that is the amount of money that was used to balance the fiscal 24 budget, which was right around 16 million. I can look that up.
That would be helpful.
Mm-hmm. Sure.
Well, I guess another way to say that was, well, not exactly. It's because, but you basically, when we have a number of basically budgeting fund balance, issues if it doesn't get spent, it would return to fund balance.
Because it has been used to balance the budget, it is an assignment. So it's not available for you to use for any other purpose for fiscal 24 because you have already made the decision to use that to balance your 24 budget. So that's why it's pulled out and put into an assignment. Which
historically has been returned
Correct.
At the end of the year and has not been spent. So that is it.
Mr. Chairman, our consultant that's working with our finance and budget team started this week, and so we are knee-deep in all things fund balance. We're just trying to provide some high-level overview of how PAYGO is currently calculated. This is an example from FY23, but I hear you, we are all over fund balance.
Okay, good. All right, since you're all over it, I'll be quiet for the moment.
Certainly. So again, as Chantal mentioned, the point here is that our amount available for PAYGO is derived from this calculation each year, and the amount that is available, to give some context, for the last 6 years, this kind of gives a picture of what has been made available at the close of the fiscal year. The fund balance policy that I mentioned was that the general fund should have a minimum of 14% available each year. This policy was amended on April 27, 2015, with the goal to ensure adequate fund balance remaining while also minimizing the necessity to issue debt and to fund economic development projects. So our fund balance policy does direct the CFO each year, once the fiscal year has closed, to report on this funds available, this fund balance available, which we have historically used for PAYGO projects.
We won't know the fiscal year 24 numbers until after the audit closes.
That's right. That's right. So, and we'll talk about what that
Kim,
process has looked like.
I have a question with regards to the percentages. I can't do the math like Don does in his head, but of that $24+ million from 23, of the 14%, what's the difference in terms of how much are we over that 14% from the policy?
Well, the 14% is one allocation of fund balance, and then after we make all of the allocations, including the 14%, what we had left over is the number that's shown for PAYGO.
Yeah, and that's the amount, the percentage amount that I'm trying to get to.
I'd have to,
see, yeah.
I'll run that
You don't
number.
have it now.
Right. Percentage of total fund balance?
Over the 14% that we're supposed to have in that.
Okay, sure.
Thank you.
So as a review, it has been county practice. Again, you've seen this in our 2023 PAYGO discussion as well. These are the criteria that have been used for PAYGO funds and for PAYGO projects in the past. 3 reasons here: for debt avoidance, projects with a positive return on investment, and economic development. We did add a criteria to mitigate the loss of some revenue loss due to ARPA this last fiscal year. But these 3 main criteria have been what we have used for PAYGO projects in the past. There is a listing here of some examples of what those projects, how they fall under those categories for some existing PAYGO projects. This gets at our current timeline for how we address PAYGO. The process is that we identify potential projects through the budget development process, through meetings with departments and through requests made. The budget team typically will include in the budget ordinance a list of possible PAYGO projects that could be for your consideration should the funds be available when the fiscal year closes. And then the PAYGO amount is identified by the finance team after the audit, the year closes. That's typically around October, November. And then historically around December, budget will bring a new PAYGO capital projects ordinance to you with projects for your consideration and to adopt that new CPO. So that's kind of how the process has gone in the past. If we're looking at PAYGO with our comparison counties, PAYGO as a capital financing tool is certainly used by most peer counties, and that you can find that in their CIP, their capital investment plans. Buncombe, Mecklenburg, Waite, New Hanover, Guilford, they all identify PAYGO, which is a pay-as-you-go tool for their capital funding for their county projects. This may be mentioned in their resources as general fund transfers, appropriated fund balance, current resources, reserves, and savings. As an example, in New Hanover County, their fund balance policy is very similar to ours. They do a percentage of 21%, and anything in excess is directed for potential use for capital improvements and capital outlay plans. So their fund balance addresses the use of the funds in a similar manner to ours. Typically, the PAYGO funding decisions are made in an adopted capital improvement plan and our CIP. Forsyth County does have a 6-year CIP plan that identifies capital projects and their financing sources, and it is developed during the budget process and is included in the annual adopted budget. PAYGO projects are appropriated, however, each fall. You just saw the timeline when the funding amount is identified by finance, and then usually around December, a CPO is brought back to you for approval. And then even beyond that, typically projects are brought back to you for specific approval.
May I ask, is this particular mechanism, or at least by this name, typically used only by counties and not by municipalities? I don't recall having heard it used in the context of the City of Winston-Salem budget.
The city does pass a capital improvement plan
Yes.
that may use pay-as-you-go funding for.
It doesn't label it as such.
It may not. That's right. That's right.
Thank you.
So as a proposal, as we've kind of done a review of the criteria that we have historically used for PAYGO projects, again, this is the debt avoidance, positive return on investment, and economic development. That is comparable to our peer counties in their review of capital projects and typically in their CIP. The fund balance policy, our fund balance policy does direct that in annual excess of the fund balance amount, again over 14%, that be brought to you for your consideration for use for capital projects and economic development projects. But the proposal could be a change to the process to develop a CIP process to include PAYGO as a potential funding source for all eligible county capital projects. And what I mean by that is we mentioned the time frame, so we pass our annual operating budget. We have our amount identified in the fall. We bring typically a CPO to you for those capital projects in December. One potential way forward would be to take the identified amount of fund balance in the fall and to wrap that into planning that would start later in the fall and into the spring for total county capital projects. So where you see at the first bullet here that PAYGO amount would be identified, the capital request would be submitted to budget management. Possibly a committee could be developed to discuss those requests. Initial CIP could be submitted to you for review, and then that process would sort of be concurrent with the annual operating budget development process. So the benefits of this change to the process, again, if this is the will of the board, is that staff and elected officials could develop priorities in the context of all capital projects. Ideally, the CIP would provide a clear list of PAYGO projects and all capital projects that are funded and unfunded for easier communication with you all and for internal departments, and could improve continuity and planning across the fiscal year. So I say this in that this is, again, the start of the conversation. This is a suggestion for how to proceed from here. However, I hear from the board that there is a desire to develop a standalone PAYGO policy. That is something that we could go back and do and work with some internal stakeholders, in particular finance, to start to draft something that really would identify the uses of PAYGO as being county capital projects. We could formalize those criteria that I mentioned, the debt avoidance is 3 criteria, and could even formalize the process if that's something that you desire. So happy to hear from you or answer any questions you may have. Of course, I've got Budget Director and CFO here as well if we can help.
And the only clarity I would just provide is, right now, typically in the budget ordinance, we're listing just a whole bunch of projects that we may fund, and we may or may not have the money for it, right? And so then we bring back after the year-end results, kind of a definitive number, and sometimes those projects that we recommended in the budget ordinance, sometimes we move forward with them, sometimes we do not. And so this change for us would be, once we got a number from the CFO, say it's $15 million, then we would roll that money into the following year's budget so that we actually have a real definitive budget that we're working with, and it would be incorporated into a capital improvement plan. And I know all of you have seen we have a lot of just different project ordinances, so our hope would be that we would shore up some of the project ordinances, work towards what the PAYGO, which the board did approve a policy in 2015 that it is for capital projects for the county, and so it would be part of a more formalized process. So just kind of wanted to provide clarity on our thought process for that. And we thought this would be a good year because we don't have any major things that we need to push forward in December, January, because we're trying to close out a lot of the things that we currently have. And so this would give us a clean slate if we wanted to change our process timing a little bit.
Yeah, it just seems to me you're identifying capital improvement projects is the issue when PAYGO is only a tool. Currently, we do sort of talk about them separately. They're kind of like there's PAYGO projects and then there's CIP projects, when in fact they all should be, the CIP projects should guide.
Correct,
And it could be not just PAYGO as a source, it could be bonds, it could be whatever. I mean, in fact,
and that is what's currently happening for a lot of these projects. We're using 2/3 bonds and lobs and all of those things, and then we also may supplement it with PAYGO, but we're really talking about it separately, and so then sometimes it gets really confusing. And so if we talked about it in one context and had it all in one plan, we feel like it would be clearer and easier to understand and also easier for us to manage.
Yeah, I think what the CIP plan should be more than 1 year. PAYGOs is just a window of 1 year, 1 year, 1 year sort of things, although some of the 1 year things don't get finished. And so then it carries over into a PAYGO project from 1 or 2 years ago, and that's lined out somewhere and listed, which also that is very confusing, that part. But you could, in a CIP plan, you could say we're going to do just like the agriculture park, for example. It is a multi-year project. It is now started. It will have a cash flow part of that goes into, you earmark dollars, and you kind of look at it, things by year. And then there needs to be a really good criteria for the smaller projects that really get at it, because conceivably there could be a bunch of those that a lot of people would like, and then there needs to be a good, for example, safety issues first. It kind of has a prioritization of each of those projects that are identified. And that's something you all may use, but we don't ever see that. We don't ever see what criteria is used in that. And it would be nice to see and I'm sure there are projects that people suggest that never show up on a list. So it would be kind of nice to kind of look at all that kind of stuff. I think that could be done. I think this is a good process improvement. It's not doing anything money-wise. It's just a process improvement that could be better. Any other questions for Kimberly?
More of a comment. The downside of consolidating this with the regular budget is the degree to which it concentrates the necessary policy-making, decision-making each year in that limited time period. So we're going to be in a position to give less focused discussion on the capital improvements that are funded by this method when we are doing so in the context of the entire budget. The advantage, in theory, is better coordination with the budget. The disadvantage is, frankly, less time from the key decision makers, us and management staff and department heads, to actually focus on the utilization of this tool.
So I think our proposal is that we are bringing it to you sooner. So because again, we will get the actual number in December, January, and so then we would work towards what those projects would look like and could start having discussions with the board in March. So it would give you plenty of time for discussions, but it is trying to still plan as a part of the budget process for the upcoming year.
Yeah, so, but still, what it does is it shifts the decision-making time focus from one that starts in December, or rather to one that starts in December, from one that starts in September annually. So you have yourself, your supportive team, and the commissioners not focusing on this question during the fall when it has been doing so, but trying to focus on this question as a part of the larger budget during a time period when the commission has been historically focusing on the operational budget as opposed to the capital.
I actually think it's opposite because right now we are incorporating suggestions in the budget ordinance with really little to no discussion with the board. It's just a list of projects. And then we come back to you in December, January saying, do you remember those list of projects that you agreed on in the budget ordinance? And then we're just asking for your approval to appropriate the dollars. And so in this process, we're saying we actually want to spend more time with you to discuss these projects, and then it is adopted in the budget.
Not last year, but in previous years, wasn't the commission actually voting in December on the utilization of the PAYGO funds, the actual utilization?
You were voting on the actual utilization, but it was based on a list of projects we had incorporated in the budget.
Yes, but again, the final decision based on how much money was actually available and what projects are going to make the cut, that vote, that deliberation was taking place effectively in October and November, and the decision being made in December. What you're talking about is a planning timeline that would shift it forward into, beginning at the earliest in December, but then the decisions being made with the regular budget cycle, the final decisions of allocation being made with the regular budget cycle, that historically and on the commission, as I experienced and as I understand has been the way you've been doing it for quite a while, it really, the data, the recommendations don't really reach the commission until May for a June decision-making.
Yeah, it doesn't
cycle.
I think it doesn't get vetted very well. And I had the same thought about the crunch that occurs at budget time. You're so busy focusing more on the current fiscal year budget, not this. In fact, it's never discussed in the context of a CIP plan. But we just talk, and I probably see that what you're getting at is some of those decisions tentatively are made back in the previous June 30th. Correct, the actual number gets determined from, we have an anticipated PAYGO, because PAYGO was kind of synonymous with the capital project work and not as a part of not really part of a bigger CIP. But kind of firming up the thing, and then December was really acting on things that were conceived of and approved of in a list. They weren't approved, they were tentatively identified on June 30th for the new fiscal year budget, and then they were locked in once dollars were firmed up. And I probably see it instead, I see it I think what you're getting at is starting in February, because it says February initial CIP, conversations in the context of CIP, which is a bigger issue because on the CIP, we will continue to see the agriculture park till it's done. I mean, that'd be a part of that's a part of the plan, and it has multi-year funding. And then you find this, and of course, we've identified the sources already, which is a combination, in this case, mostly PAYGO into that, and there's several pieces of dollars. There's some bond issue dollars in that. There's 4 or 5 sources that are in that, and so we got comfortable that we had enough money to cover it. But I think if the CIP was discussed in the spring and kind of more only included in the annual, but this wording is CIP reviewed, I think it's like the CIP is included in the budget, and you just make a decision before the budget, not during the process.
Are you contemplating a process in which we're charging the county manager's office with delivering recommended capital spending plan, at least
February.
tentatively, in February?
Yes.
Not in May?
Yes.
That would work.
That is correct. That is correct.
That's the way I'm reading it.
That we would be discussing it at that time. But whatever decisions are made would be incorporated into the budget approved, because that is what our counterparts are doing, is that they are adopting their capital improvement plan, which includes PAYGO, in their budgets. Right now, we're including it in our budget, but we don't really discuss it. But if the board wanted to approve it in March and we still roll, I mean, that would be fine, but.
It's kind of like the PAYGO money that's identified back in the fall. Instead of doing something in December, you're really not doing it until the following June. It's kind of like you're moving when you're talking at the budget time, you're not talking about PAYGO dollars you don't know about, you're talking about PAYGO dollars you do know about. That, which is, and I would suggest that the other part is that we don't spend much time discussing it. And I think that needs to be needs to be an agenda item that says, now we discuss it and I think you approve that way before, like approve it in the end of April. You get something in February, in April, we should be able to approve that, and then it gets recorded in the actual budget. We don't even worry about it in the budget because it's all done. And it's just listed. It's included, not reviewed. The word reviewed is not good in this box. It would be included in the budget.
And so again, what we're contemplating at this point is asking the county manager's office to deliver this material to us, beginning for board discussion, beginning in February, in that time frame.
Yes, and it's based on, theoretically, in this year, which would be the transition year, then theoretically, we've already tentatively allotted some of the dollars that would be a part of in the year you translate. We've got a tentative list in our budget ordinance right now.
We did not this year.
We did not include
We did not include anything this year, which is why I'm saying this would be a great kind of, we typically have, but we did not this year because the board decided you just wanted to address it in December. So that's why I'm saying this would be a great time for us to reset.
You're right. I think I remember that discussion, but we had a list of, because some of the dollars included in that agriculture park were PAYGO dollars that anticipated to be identified at the end of the.
We did not identify anything in the budget ordinance for FY25.
We did talk about it, though.
We did have some discussions, but we do not have any board-directed initiatives on that. We have no list.
Okay, well, that's good.
Sounds good.
That's good. Well, then that's perfect. So then we don't even talk about it in the fall. We'll deal with this in February. I think that's good.
Yeah.
I like that.
Let's go. Get to the good part.
Thank you, Ms. Bussey, and I do want to give a special thank you to them because they pulled this together while they were closing FY24, so I do appreciate the work on this.
I do too.
Thank you.
Thank you.
Our last discussion item is also a board-directed initiative, and this is about our community grants / special appropriation process, and Aisha Carter will brief this item.
Good morning, County Commissioners.
Morning.
All right, thanks, Tim. All right, again, good morning, County Commissioners. This presentation is in regards to the proposed community grant policy for Forsyth County. So just a brief introduction. Yearly, Forsyth County Board of County Commissioners funds various nonprofit agencies not necessarily associated with departmental responsibilities. That funding is called special appropriation, and here now going forward will be called community grants. On June 13th, 2024, the Forsyth County Board of Commissioners approved the FY25 budget ordinance awarding community grants of $1.8 million for 27 projects. During this meeting, the Board of County Commissioners requested that staff propose a formal process for community grants similar to the American Rescue Plan Act. This presentation includes a proposed community grant policy based on research of local government community grant management. So here's a snippet from the ordinance that was approved by the Board of Commissioners, Section 15, grantee organization agreements. It basically states that funding for agencies is not guaranteed and organizations should not depend on county funding. So what to expect from this presentation? You'll get the Forsyth County history of community grants, community grant process of other local municipalities, a comparison of ARPA to county community grants, some questions considered, and then we'll go over the community grants policy proposal. So some history of Forsyth County community grants. The county first separated outside agencies in fiscal year 1989. The budget for community grants at the time was $1.9 million, or 1.4% of the general fund budget. Now, this is not saying that this was the first time that the county provided funding to outside agencies, but it's the first time that they kind of put them in a bucket separate from other funding. Organizations that were funded in fiscal year 1989 was Experiment and Self-Reliance, Renew the House, the Arts Council, Chamber of Commerce, and Senior Services.
I just want to point out that's more money that was allocated this year. That was for your purposes, Gloria.
So this graph was pulled from some research done back in 2020. It basically shows the comparison of the total general fund budget to community grants.
You can see here that the total general fund budget is steadily increasing and that there is a lot of fluctuations in community grants. And this fluctuations is due to community grants moving in and out of cost centers. A good example would be senior services. This year, we got rid of the aging services call center and moved senior services back into the community grant. Same with special appropriate Shepherd Center.
So the blue line axis is on the right side, the increments. The orange line is on the left side.
Yes. Also, another good
this
example
chart.
would be the juvenile crime prevention funding. It was once in community grants funding, and it is moved to its own call center and youth services. Then you can see here in fiscal year 2015 that there was no community grants as all the funding went into the departments. And then in this year, it hopped out. So next page shows Forsyth County community grants over the past 5 years. For the number of funded programs, it averaged about 20 programs. And then you see a comparison of the total percent of general fund budget. So the average there is about 0.32%. The next page show the current defined process for community grants for Forsyth County and some noteworthy items. Our time frame. So our time frame for community grants is January, starts in January when we do a public notice. And then January through February, there's an application period. In June, a public hearing on the proposed budget. And then mid-June, the Board of Commissioners adopt the budget ordinance. There is no set minimum or maximum award per agency, and the recommendations are completed by the Board of County Commissioners currently. So next we'll go into the community grant process of other local municipalities. So here you see a chart. First line is Forsyth County. Forsyth County, again, application period is January through February. The review and recommendation is done by the Board of County Commissioners. There are no max or min in regards to funding restrictions. And then the location that manages the community grants is the Budget and Management Department. For the city of Winston-Salem, they are currently reevaluating their process. Before this year, they had a Community Allocations Committee review the applications. So that was early October to November. That's when they started the application period. This year, the Board of County Commission, the council reviewed those applications. And that was similar to, application period was similar to Forsyth County's January through February for this year.
So I do have a question, if you don't mind. So with the city of Winston-Salem, in their allocations, because they're in wards, were they given a certain amount and split, or how did that, or do you know?
I did not see that anywhere.
Okay.
I just seen that there was no max or min, but I do not think that they did.
The rhyme or rhythm for
But I'll
how
look
they-
into it. They did send me the policy yesterday.
Yeah, okay, thank you. That
Detailed
would be
version of
helpful.
it. Okay.
If I may, unless they changed that in the last 2 budget years, no, they were not made on a by ward basis. It was a citywide matter.
So with that being said, what would a city council member do if they wanted allocation for their wards?
The community grants process was not made on the basis of wards in any formal way ever during my 19 years on the council.
It was a committee.
Yeah, so the committee.
They would make the recommendations.
And the committee was a fairly recent process. I don't remember what year that started, but it was an attempt to rationalize a process that had gotten completely political.
It would be helpful for me to kind of see the map in terms of where that funding transpired in which wards and what was important to them. So I'm just trying to get into the mind of the city council members to see, how much each one of them were allocated, if it was that way, or where those dollars were spent.
Okay.
All right, thank you.
I'll look into that.
Thanks.
And that committee was a citizens committee.
That is correct.
Yes.
And what does that restriction of seed funding 5K for the city mean?
Yes, so for the city of Winston-Salem, there is no max or min in regards to funding, but they do have one exclusion, and that is seed funding. So what seed funding is if an organization was recommended for funding, but they were not eligible for funding, yes, they are limited to $5,000 for 2 consecutive funding years.
What would
What?
make them eligible?
So an eligible, a good example would be one eligibility requirement that I've seen throughout all the counties is a 990 form. So if you are a new nonprofit, then you may not have a 990 form because you're new.
So you could get, so you didn't meet the eligibility, but you could get $5,000
You can get
for 2
seed funding for
years
$5,000
while you're waiting around to get it,
until you prove yourself.
Until you have a 990. So after 2 years, if you don't have a 990, you quit being a seed project.
Yes.
So
From
you
my
had 2
understanding.
years as a seed project, up to 5,000 without a 990.
Mm-hmm.
Okay, got it.
That would be a good example, just not having a 990 form. I'm not sure of any other cases, but I know that that will be a case. For location, that manages the community grants, the budget and management department, also the city of Winston-Salem manages their community grants. For Orange County, the application period is a little bit earlier than Forsyth County's, November through January. And the review and recommendations is done by an advisory board and the county manager. They have no funding restrictions, no max or min, and the location is a separate department called outside agencies. For Durham, a lot of the information I found out about Durham was through that research from earlier in 2020. But one thing that did stand out here is that they only provide funding for program expenses. They do not do any ongoing or indirect expenses. Also, their capital expenses is limited to less than $5,000. Their location is within the departmental budgets. For Guilford County, they have a similar application period to Forsyth County, January through March. The review and recommendation is done by county staff. There is no funding restriction, so no max or min, and the funding is located in the departmental budgets.
Can I ask you a question about that? I think there was something in the, it may not have been in the newspaper, but it was in maybe one of those, not a tabloid, but with a couple of.
The Rhino Times.
That's it. Maybe it was in the Rhino Times. It was in the Rhino Times that actually talked about the individual Guilford County commissioners making decisions about their community projects and kind of, I can't remember the details, but was it close?
They basically said there were no open discussions about it, and it was just approved within the budget.
So the idea of the review and recommendations from the county staff would not exactly be true. If the Rhino Times is true, then it wasn't the county staff doing the review and recommendations.
I'm not familiar with that article, but this is the information that I found based off of their policy.
Well, I think this year's the first time they've done that, if I read it correctly.
That is correct. I think what the article stated is that they typically do have a more formal process, and something was different this year. Again, if it was accurate.
Right.
For Mecklenburg, the application period is November through December, a little earlier than Forsyth County. The review and recommendation process is also done by county staff, similar to Guilford. And then they do have some funding restrictions. There's no max or min for any agencies, but they do have this thing called the sunset clause, and that basically states that if an organization was awarded funding for 3 consecutive years, that they must apply as a vendor for the county to a department. If they are not selected by a particular department, then they cannot get funding for 3 consecutive years. And then they also have a restriction on indirect costs. Indirect costs needs to be less than 4% of direct expenses.
I like that one.
And in regards to location, they have community grants, both separate and in departments. And the ones that are in the departments are the ones that are sunset.
So, if I may, Chairman, I just wanted to get this off my chest. With regards to the word special appropriations, the ARPA funding, yada, 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 knowing that this process has been in existence since 1989 and the great work that many of these organizations do in our communities, if I hear another commissioner, and I apologize that my colleague from District A is not here to hear it today, say that this is political, the whole budget is political. These organizations help move this community forward. So we need less safe and security from our sheriff's department. Our teachers need less because they're getting help with the students and the teachers. And I want to say that I appreciate the staff. No, the process isn't not perfect, but you've done a great job. And looking at what these other municipalities do, I think that we, have created a good process, and we're continuing to move that process forward. So again, if I hear another person say that this is political, the whole budget is political. So I'm done with that. Thank you.
So the next page is FY25 funding comparison based off of the local municipalities. For Forsyth County, the number of funded programs, 27. Total percent of general fund budget, 0.32%. City of Winston-Salem had 21 funded programs, 0.43% of the budget. Orange County, 44 programs, 0.3% of the budget. Thurman, again, a lot of the information was found in fiscal year 2020. I did not find the number of programs because they're in their departmental budgets. For Gifford County, the number of funded programs, 41, and then that is 0.2% of the budget, and theirs was the only one that I found was FITS. They have a FITS percent of their general fund budget for their community grants, so it's 0.2%. And then Mecklenburg County, 17 projects funded at 0.12%.
Is it possible in Mecklenburg, because I noticed on the chart before, it has, under the location, it has both separate and departmental. Is it possible that maybe some of their, I can't imagine in a
It
1.6 billion, so there must be some departmental.
The departmental one, if you add the departmental ones into it, it's about 0.45%.
That makes a lot more sense. Right, got it, okay.
So the Forsyth County ARPA process, here is a flow chart of what the Forsyth County ARPA process was. The Board of County Commissioners determined what those priorities were. We held information sessions before the application opened. Application period opened and closed, so the applications were submitted. Eligibility and risk assessments were complete by county staff. Measures and outcomes were identified. Allowable costs identified. And then recommendations were made by independent subject matter experts. The manager presented those recommendations to the Board of County Commissioners. The Board of County Commissioners voted on those recommendations. We established a method of payment, and then contracts were executed.
And I'll also add that I appreciate my colleagues on this board who have put together this process along with staff. When I first got on this board in 2018, we didn't have any of that. And I did feel like at times that we were writing blank checks. But now knowing that we have checks and balances to keep us accountable and those organizations accountable, I just wanted to repeat that this process works. And that also we should applaud ourselves because we were the first to start this process when no one else had one. So thank you. I appreciate you.
Thank you. The next slide, we have the Board of County Commissioners. In looking at that flow chart in detail, we'll kind of go into those different areas. So the first area was the Board of County Commissioners determines priorities. For ARPA, again, the board set those priorities for funding. For community grants, currently, there is no restrictions on funding. It is just an open application process. We do propose that the county only considers applications that align with the county's mission. And the mission basically states, to create a community that is safe, healthy, convenient, and pleasant to live in, with educational, cultural, and economic opportunities for everyone. So those applications should be able to fit in one of those: safety, healthy, education, cultural, or economic opportunities. A good example for cultural, arts and tourism. So like the Arts Council, for safety, anything related to gun and gang violence, health, anything in the Health and Human Services department.
So I will say to our new county manager, what would be helpful for me moving forward through this process, a lot of times I would also agree with Commissioner Vesey that we spend a lot of time negotiating where we're going to support dollars in terms of these organizations. If we knew that we had $1.2 or $2 million from the beginning, before we got to this process, it would make it a lot easier. We have organizations that may apply for $100,000 and maybe we can't commit to the $100,000. So in our negotiations, we land at about $25,000 or whatever. So in the future, knowing that number would be helpful in terms of knowing how we could commit to supporting those organizations in our budgets in the future.
And I think for us, we really just, we're proposing a process so that we have direction on if the board wants to continue doing how you have in the past. And in our budget, we have historically budgeted what was provided in the previous year. So we're rolling over kind of the continuation budget unless the board directs us otherwise, or of course, if we have any other budgetary restrictions where we just do not have those funds available. But in general, it's usually the dollar amount that was appropriated the previous year.
Next slide is information sessions. For ARPA, we did have information sessions and we did require compliance training for individuals that were awarded funding. Currently for community grants, there are no information sessions and there are no trainings. We do propose that if we have an early application and review process, that we have those information sessions and trainings for community nonprofits.
And if you don't mind, could you just talk about that a little bit? Because this is really important. Individuals believe in my community that they're not funded sometimes because of some kind of political whatever in the background, but it's not true. Knowing that this compliance training is available for them, I don't think that they're always, some are not always honest in terms of why they weren't funded or not. But to know that there was a process that we put in place to help them, if they're not ready today, they possibly will be ready someday. So if you can talk about that a little bit, that would be helpful.
Sure. For the information sessions, that's more so to go over the application and just to provide technical assistance if anybody have any questions about the application process. For the required compliance, that's after you actually are awarded. So they meet with, more than likely was an online training with our compliance manager, where they go into details of what's expected of an applicant in regards to performance measures and then monitoring and compliance.
So in this process, we should never see an organization that doesn't have a 990 or budget.
Yes, we'll get into that.
All right, thank you.
So next is eligibility and risk assessment. For ARPA, there was an eligibility and risk assessment performed by staff for community grants. Currently, there is no eligibility or risk assessment. Again, it's an open application and process, and the decision is up to the Board of County Commissioners. We do propose to continue with no risk assessment. A true assessment of risk occurs during monitoring and review. So instead of having it beforehand, do it once we're actually in the weeds of it. But we do propose an eligibility assessment, as well as all agencies are subject to on-site visits if awarded. Not required, but subject to on-site visits.
If I may ask a question relative to the on-site visits, what would trigger an on-site visit?
If anybody who's reviewing the application has questions about the measures and outcomes, if they're having trouble with providing backup documentation, or if you just want to see how that organization is ran.
Mm-hmm.
So when looking at the eligibility assessment, applicants must answer yes and show proof of all to be eligible. They need to be a 501c3, so a nonprofit. They need to be registered with the Secretary of State. They also need to have on file their most recent 990 form. And that kind of goes back to the city of Salem and not eligible because they don't have a 990 form. Other questions will be, would the organization use locations within Forsyth County limits for requested projects' primary service place? Does the organization have an office in Forsyth County, excluding arts and tourism? Will all funds serve Forsyth County residents? And does the organization conduct requested projects, activities, and programs in Forsyth County? So we want them to answer yes to all of those questions.
May I ask, why exclude arts?
Because they're bringing people to the county, so it wouldn't be a Forsyth County residents. A lot of arts and tourism kind of is combined. So like the murals or
Any arts
the
events?
parks. What is the parks? The park program where they have the music, the concerts. That's bringing people from outside of the county to the county. The concert series.
I understand
May not
what you're
always
talking
serve
about.
just-
I'm trying to consider whether there is a difference in kind between an expenditure by an arts-oriented organization in terms of who they're paying for a service, and a anti-poverty organization, and who they're paying for service. The intended beneficiaries in both cases, I think when they're coming for funding from the county government, needs to be residents of Forsyth County. But you may be paying someone to undertake a particular anti-poverty project who doesn't live in Forsyth County, but the intended beneficiary are residents of Forsyth County. Why? So, we would anticipate, or apparently we do anticipate, that artists elsewhere are being brought in, with county funding from elsewhere to entertain residents here. That doesn't seem to be categorically different for an arts activity than for any other type of activity that we might fund. The intended beneficiaries are residents here.
I think for us, the clarification point was that arts and tourism, museums just didn't fit as clean of a box as service organizations. So when we're doing reporting, say for, I'll use senior services as an example, we're asking what percentage of those residents live in Forsyth County. And if they say 95%, we are only going to provide 95% of the funds because the other 5% needs to be paid by the county in which that person lived. We understand that for like Callidium as an example, that there are people that are in Forsyth County that's going to go to Callidium, and there are people from all over the state and even country that may come. And so when we're looking at measures and outcomes, it's just a tad bit different. So that's just kind of why we stated it as such. Certainly we could do something different, but in our minds, when we're looking at reporting, it's a little different.
Well, I think that's a good explanation for why Callidium is going to be serving a broader audience than Forsyth County residents. I don't know it's necessarily a justification for our spending, county tax funds on Callidium in a different way than we do other organizations. In other words, sure, Callidium's going to be getting visitors who don't live in Forsyth County, but they're also going to be getting revenues that don't come, or should be getting revenues that don't come from Forsyth County taxpayers.
But that also assumes that all revenues will in fact pay for services delivered. I mean, it's hard to split that. Hard to split that baby, I think, a little bit. I kind of read that more about exclusivity issues. I mean, if you're serving, like if you're doing a program that serves, young children who need a particular medical something, or whatever, something like that, then we're not doing that for poor children over in Guilford or Stokes. We're doing it for our young people who need that service. Whereas Callidium is going to be just, it is attracting people. In fact, that the additional people that come in should allow a lower dependence on taxpayer and local funds. In fact, I'd even argue, using Callidium as an example, that their dollars from us have been flat for about 6-8 years. I mean, it hasn't been growing, and it's been basically a flat. And the city is, by the way, the exact same way. They have a set amount that they have provided. I think the city's actually gone up a little, perhaps. But yeah, I don't know, saying that it's almost like we really want to serve, that the people being served are going to be majority Forsyth County people. We're not doing it for people that are going to be serving lots of others. That's kind of it. And obviously,
and we can clarify the language.
And arts and tourism actually does serve Forsyth County people. I mean, they have the opportunity to go to the performance or go to the whatever. They're getting that opportunity too.
It does, but if, again, reporting-wise, if we treated it exactly like we do service organizations, and we asked them what percentage of Forsyth County residents were at your concert series, and if they said 50%, then we would be only paying 50%, but we recognize what they're doing is different than service organizations. That's all we were trying to say, but we should not have used the word excluding.
Those summer concert series are not charged. I mean, they're free. They're free to the public. But obviously, if you live in Davie County and there's something going on at Tanglewood, you could come. I mean, and I think that's part of the issue too.
Okay. Moving to the next slide is measures and outcomes. So for ARPA, we did have performance measures detailed and validated. For community grants, we do collect performance measures. They submit them, but they're not validated. And what I'm saying there is that for ARPA, we do ask for backup documentation. They provide sign-in sheets. They provide flyers, assessments, evaluations, client data reports. And for currently the community grants, that's not the case. We do propose that going forward, performance measures are detailed and validated. And then the detailed deliverables include the type of service provided, estimated number of residents to be served, the general social economic characteristics of residents to be served, and then outcomes to be achieved. Allowable costs for ARPA, every dollar is identified. And for community grants, the general cost is identified. So for community grants currently, we say they're getting operating or capital, but for ARPA, we identify every cost, how much is going to personnel, how much is going to rent, how much is going to materials, how much is going to training, capital, et cetera. So we will want the same thing going forward for community grants.
And let me say, I think that's probably the most important reform I've seen so far.
Yeah, and indirect costs should be included in that, not just operating capital, but indirect costs. In the community grants, you would also like to see what the indirect cost numbers are.
We have
That
a
goes on
proposal for that.
Yeah, I'll mention that on another slide. For the review process, ARPA, there is review and recommendations by subject matter experts. For community grants, currently the review and recommendations are done by the Board of County Commissioners. We do propose that there is an eligibility assessment by staff and recommendation by subject matter experts. And subject matter experts don't necessarily mean just staff. A subject matter expert might be Superintendent McManus or Dr. Spriggs for Cypher Tech. And then we propose an earlier review process as well. In regards to payments, ARPA, all funding, well, for the most part, all funding is on a reimbursement basis, and funding is provided on monthly. And they do provide proof of spending. They provide receipts for that funding. For community grants currently, they are paid in quarterly equal installments. So if you were awarded $100,000, you got $25,000 each quarter with no proof of spending. We do propose that we do propose that a monthly reimbursement basis is used for community grants, and they do provide proof of spending. If they are not able to operate on a reimbursement basis, similar to ARPA, they can apply for financial hardship, but they must show proof of hardship for an advancement.
So I have a question.
Yes.
Oh, so is there going to be a box that they need to check, or how does that communication happen?
It would be an email, and it's kind of detailed in the policy, but they would have to provide backup documentation, their financials kind of showing that they have a hardship.
Sure. And in the quarterly installment basis, what does other municipalities or counties do?
I've seen one thing that was specified, I think Mecklenburg. Think it was Mecklenburg. Let me make sure.
Sure.
Call out one county, but
With the
at
installment.
least one county gave $100,000 up front.
Yeah.
That was the only thing I've seen that kind of stood out to me.
Yeah.
That was Guilford County. So they awarded up to $100,000 up front, and then that's if the award was under $100,000. If it was more than $100,000, they would give $100,000 up front, and the remaining balance on a quarterly basis.
Yeah, so then this alludes to my next question. In the quarterly installment basis, do they get that once we approve it? Is it 4 months that they get the reimbursement with the receipts, or how does that work?
Say that question one more
So
time.
for example, once we have approved it, the commissioners, do they have to provide 4 months of receipts and then they're reimbursed if the hardship does not apply?
How are we handling the current process for their quarterly installments today?
Okay, for the current process, they receive payments after the application is approved. After 3 months, they get their quarterly installment. And then they're supposed to give us the performance measures when they get that quarterly installment.
Well, I will just say this for correction in the future, because I know that they have a responsibility, but we have a responsibility to make sure that they're getting those payments timely. And I'll just leave that right there and you can keep moving. Thank you.
Right.
All right.
And then no funding for indirect or ongoing expenses, and that kind of relates to the ordinance where they're not guaranteed funding, so we wouldn't want the money to be tied to their ongoing or indirect expenses. They need to go to programmatic expenses. In regards to contracts,
Can I, before you start, I'm sorry, I had one slow thought. With the receipts, is there a portal that they scan those receipts back through, or how do you get the receipts?
Neighborly, we use Neighborly
Okay.
for the application as well as the measures and payments, disbursements.
Fair enough, thank you.
So for contracts, ARPA is one-time federal funding. Community grants is one-time fiscal year funding. We do propose that we continue with the one-time fiscal year funding, and that each year, each applicant is evaluated independently of any prior year funding decision. And then last, considerations. Before the Board of County Commissioners decide to, or if not, adopt the drafted proposed community grants policy, does the Board of County Commissioners want to commit to long-term funding for any specific agencies? And then also just consider staff capacity to manage the new process.
And I do want to add to that. And so for us, what I know I've heard from different board members, different things, are there any specific areas that you feel like you want to always be in the continuation budget, or are you okay with evaluating it on a year-to-year basis, which is what we're recommending, but certainly we are open to doing whatever the board chooses. And I'm sure there's maybe different opinions about that. And then also, I do want to lift up, this is a new process and will require additional staff time. And so we really will need to evaluate staff capacity on how to be able to manage this process. But certainly we're committed to doing it, but I do want to let you know we may be coming back to you for support on that.
And that's fair. I just will say that once the ARPA process has expired, will those individuals move to the community and economic?
So that is certainly something we are discussing. So a couple things. Kimberly Price Shore not only does ARPA, but she is our grants and compliance manager, and the county has a lot of grants beyond ARPA. We do have an ARPA administrator, Bailey Arnold serves in that capacity, and certainly we are evaluating kind of the closeout of current ARPA and what that looks like for being able to assist with the community grant process. I do think, yes, there will be capacity there at some point. Probably this year or next year will be a little challenging, but yes, in general, I think that's probably where it fits. Something that I need to have more discussions with our chief financial officer on. But yes, but probably not in the immediate.
Okay, that's fair. Thank you.
Generally speaking, I like it, except I think everybody ought to be visited, kind of speaking to Commissioner McDaniel's point about who gets visited. I don't want it to look like that only if you're visited, you're suspect or something, or do it in the first. For example, you require a visit in the first year, or require a visit in the first 2 years if it was a second year funding, and then after 2 years, then it would be subject to. I could maybe accept that, but at least one visit for everybody at the beginning in the first year, and then at some point it could go to fewer.
And that's how we're handling ARPA. So it would be a defined monitoring program, which we can spell out for you all. And certainly if there are concerns, then we do more visits. But it is not more visits that's punitive. It's really to try to help and support those organizations in the best way we can.
Well, if the folks know going in they're going to have a visit, there shouldn't be a problem. There's lots of restaurants do it every day. I think surely these folks can do it.
I'd like to say that I would love for us to consider no days are the gone of the continuation budget funding, that we look at organizations in a competitive way, ensuring that we have reporting that shows that they're moving the needle in our communities, and that's how we look at funding in the future on a yearly basis. Thank you.
I have a question about the proposed guidelines, just to make sure that I understand something. And probably several comments. The question, as I understand it, eligibility, you're asking, does the organization have a 501c designation? Did the organization file its most recent Form 990, et cetera? So this appears to be focused on making community grants available exclusively for a particular set of organization. For example, from the applications that we got this year, two entities that would not be eligible for this process. Housing Authority of Winston-Salem, made a multi-million-dollar request. As I recall, didn't the city of Winston-Salem make a multi-million-dollar request?
Yes, they
So,
did.
I mean, they would be X'd out of the process. Yes?
Based off of the eligibility requirements, yes.
Well, I approve.
Well, and again, it's certainly something that the board can consider. I mean, we typically say 501c3, but government entities can be eligible, is what happened with ARPA. But it is, again, we wrote down our proposal, and it is up to you all on how you would like to handle.
No, I think it's a good idea. I think community grants should be for community grant organizations, not intergovernmental transfers.
Correct. Nonprofits. And there are other avenues for interlocal agreements for government entities.
Exactly, and it should go through those processes, not through a community grants application. Do I understand correctly that you are proposing that there be a total community grants ceiling? This much money will be available in this year, and that information be available to all applicants as a part of their application process. As they know, for example, don't come ask us for $2 million because we're only going to allocate $1.5 million.
So first and foremost, our budget ordinance specifically states that there's no expectation of funding. So there's no expectation of funding. However, if funding is available, then our baseline would be what was allocated the previous year unless the board decides through the budget process to increase that amount.
Okay. And so as a practical matter, that information would be provided to applicants at the start of the application process. Forsyth County only funded whatever it was, $1.5 million worth of requests. You should anticipate that is the maximum that is going to be available this year.
Yes, sir.
I think we need to add one of the factors that you discussed, and that is, capping an individual organization's request at a certain percentage of the total amount of funds that would be available. For example, if the total amount of funding for that year's pool is, unless the board changes it, $1.5 million, there ought to be a limit on the application of any individual organization that is pegged to a certain percentage of the year's cap. So that you could say, let me simplify, so my non-mathematics in my head mind, my example, let's say it's $1 million is the total funding cap. So we're going to say no single organization is permitted to apply for more than 25% of the total funding. So, the maximum request for an organization in that case would be $250,000. You're not allowed to make a request. We don't accept your application if it asks for a larger sum than that. If it's,
That is a board decision.
I am suggesting it for
Yeah,
our
you're
colleagues'
just trying to
discussion.
digest.
I'm processing it too, Commissioner Bessie, but for me, and knowing that there's a possibility that we could increase more applications by funding, and to limit, it could turn into a whirlwind for some of us who would just initiate a $250,000 request when we would have probably given them 100 and been able to share with other organizations, if that makes sense.
I hear that. On the other hand, there are some organizations that routinely ask for very large and increasingly large
But we never meet that.
appropriations. We don't meet it.
We try not to.
All right, let's go.
Yeah, well, I think that needs, let's talk about timing on this, because I know we got lunch and let's talk about timing. And I think some parameters on the requested amount and the maximum amount need to be clear in the project. I mean, I'm not so sure, if you take exactly and stick strictly to the same amount for the last year, it would never grow. I mean, if you followed through, your amount of community grants would stay exactly what you had from now on. And I think that could be a range of where it started, but not more than 0.3% of the total budget or something, or some kind of number, like that. So there's a way to do it.
I think, for us, just because of the application being so early, we really have no idea what our budget, what revenue is going to look like. But certainly we could come up with maybe some sort of modest growth model.
But it would be for us, the guideline would be, you're telling the folks, this is what we anticipate, this is what we spent last year. It will not exceed 0.3% of whatever our proposed budget ends up being. So there may be a little wiggle room in that, and let them know that it is capped pretty much, but we're looking at it. But I think the amount of the individual request, we can give that some thought. I understand exactly what you're saying. There's no sense in somebody requesting basically the full amount of the money we have available and thinking which it almost is offensive for me to look at that, to see that when they kind of know better. But I think that needs to be worked on. If we sort of generally like this, when do we see this coming forward as a briefing agenda item? Because I want to study, think about it. I actually didn't see the actual policy. I'd like to spend a little more time on that, but what's the sort of the time frame? What is everybody comfortable with?
I'm comfortable now, but if you need more time.
Well, how about let's just put it in the next cycle, which would be the actual briefing because we're doing a briefing today, it would be in the next briefing meeting cycle put us towards the end of August.
And just for clarity, to put a resolution to approve the proposed policy. Is that correct?
Yeah, and the briefing, we'll discuss it, and I just want to spend a little time. Several of us may want to suggest some edits to that before the briefing session.
Absolutely. Okay. Thank you.
Good. Are we done?
You. That was great. Thank you.
Thank you.
Thank you, Aisha. Appreciate your presentation and the good thinking. There's a lot of good thinking on that, so thank you. And a lot of good research on that other stuff. All righty. Are we good? We are adjourned until Tuesday, until 2 o'clock.